as a very key stakeholder yourselves, being members of the media, we want to take this opportunity to share with you any information about this event and allow you space to ask relevant and appropriate questions about this very important event. But I will begin by introducing some of the top table, most of whom will be making presentations to yourselves. I would like first to introduce to yourselves WHO representative to Botswana, Dr. Josephine Nambos. Oh, you haven't seen the Halam one. Dr. Nambos, WHO representative to Botswana. Ladies and gentlemen, I'm also happy to introduce the Permanent Secretary in the Ministry of Health, Meg Grace Muzila. Meg Grace Muzila. PS. I'm also happy to introduce one of Ma Muzila's deputies, Mr. Moses Gedi. A proper round of applause for a Gedi. I'm also happy to introduce Mr. Samuel Kolani, Director of Public Health, Ministry of Health. We also have here very important people from WHO, like my good friend Christina, my good friend Chris, and also myself, Chris, from Ministry of Health, and Labor Faith, Labor Unisi, from Ministry of Health, and others, Baba Chwanko Hagorumente, Bo Ethel, Bo Priscilla. Very important people. Iberen Nalelona, colleagues, members of the media, I'm happy you came in your numbers. I can't count, I can't say whether you are 47 or 51, but I can see you are very many, which is very good. And having said that, ladies and gentlemen, I would like to invite to the podium Permanent Secretary in the Ministry of Health, Ms. Grace Muzila, to come and welcome you all. Ma Muzila.
Thank you, Dr. Nyanga, Director of Ceremonies. Dumelang.
Good morning.
Good morning. Protocol has already been observed. Those introductions were observing protocol. And I liked it when the Director of Ceremony was talking about relevant and appropriate, because we are getting closer to the day. I think we are counting 24 days. And I remember last year when we were with media, we were still counting months. Now we moved from counting months to counting weeks. Now we are counting days. So the relevance and the appropriateness it's appropriate, Dr. Nyanga. We need now to be asking questions very relevant and appropriate. But my job here is to welcome you to this important engagement. As alluded to during the media briefing held in June 2023, that's the last one we held. Botswana has been chosen to host the 73rd session of the World Health Organization Regional Committee for Africa from the 28th of August to the 1st of September. You're going to get the details, because even on the 27th there's something happening. But the committee itself from the 28th August to the 1st of September. As a host nation, we are delighted to have been given this huge responsibility, taking into consideration that the RC73 conference coincides with the WHO Diamond Jubilee celebration. It's our 75 As Botswana, we feel blessed and privileged to be the host of these great events. Director of Ceremony, ladies and gentlemen, hosting this conference will not only position the Botswana as a leading meeting, incentive, conference, and exhibitions country, but it will also propel the country's trade and investments. You may all recall that Botswana recently hosted the US Africa Summit, which was very successful. Those of you who participated, you can attest to that. It was a success. And we had huge numbers, still a success. It was attended by more than 1,000 delegates from across the world. We were talking heads of state that time, and we were successful. So who can say we will not be successful? We will be. We're now gaining experience in terms of hosting. The more you host, the more you gain experience. I noted some of the people in the committees, they have served in previous committees, and they're sharing skills. That's what I like most, because then there is improvement. The RC73 event also promises to be another great event for this country. We are expecting at least 500 delegates from 47 WHO African member states. This is an inclusive event, and we want every Botswana to own and be part of the success. We expect many local businesses to benefit from this event across the entire value chain. I think this I stressed when we talked in June, that honestly, we are going to make sure that Botswana benefits. Looking at all sectors, it can be tourism, it can be agriculture, it can be transport, they will benefit. And already the rooms are getting full. We expect the hospitality, retail, transport, health, creative arts, service providers, as well as the informal sector to immediately benefit from the huge purchasing power that will come from the conference delegates. I talked about the huge numbers. I was talking about 500. I was told that at the official opening we are expecting maybe 800. Those numbers are huge. Coming from Botswana, coming from Africa, coming from the globe. As a country, Botswana is known for its democracy and good governance credentials. The country is also known for its growing and promising health sector that performed beyond the reach of many during the COVID-19 pandemic. We can attest to that. When it comes to education, we did very well. When we started, people were confused. But as we moved on, people knew what to do well. And we started to see even the numbers, the incidents coming down, and we started seeing vaccination rates going up. People understood why they were doing what they were doing because of the education we provided. Botswana will also have an opportunity to share its success stories and challenges in the health sector. It will also be an opportunity to learn from other experiences. So it's learning both ways. We are going to be sharing experiences. So let's not just listen to learn from them, let's share with them our best practice. Therefore, the RC73 event provides African countries an opportunity for learning best practices from each other. I wish to take this opportunity to assure you all that as a country we are ready for this event. My colleague here will dwell more on this. Like I said, the details will follow. So on behalf of the local organizing committee and indeed the government, I can confidently say that the RC73 has the support of all stakeholders, including the private sector. And as we have been working on the preparation since last year, I have no doubt that the event will be a huge success. I therefore wish to thank you as members of the fourth estate for keeping us on the toes. You always demand regular updates on healthcare services, strides, challenges, and solutions. We are confident that as a key stakeholder, you will continue to contribute to the success of this country's health sector. Director of Ceremony, ladies and gentlemen, You are all welcome to this media engagement session. The session is designed to give you, members of the media, more information about this conference and to update you on preparations being done. Please feel free to ask questions for clarity, going back to the appropriateness and to the relevance. Feel very free. Don't think you'll be criticizing. We know how to take out what is very positive and constructive from whatever comment, but as long as it's relevant and we can pick something, we are banking on you. Be very open with us, because when you are not, perfection may not be possible. We want to improve until when we get to the day, we are very close to being perfect, but nobody can be perfect. But otherwise, let me welcome you and wish you productive discussions and feedback. Thank you.
Thank you very much, PS. Can we have a proper round of applause for Mountain? Ladies and gentlemen, that was Minister of Health, PS, Ms. Grace Muzila, welcoming us all, and also setting the tone for that which will be discussed this morning. Let me also indicate to yourselves, ladies and gentlemen, that everything that will be happening here is being live streamed on the Ministry of Health Facebook page. What this means is that everyone from wherever they are will also be able to watch and benefit from the discussions of this event. I think the other thing, taking from what the PS said, this is a media engagement event. You see, this is bigger than a press briefing. It's bigger than a press briefing in the sense that whereas in a press briefing you would have one presentation or one statement being delivered to yourselves, and then you are required to ask questions. For this one, you are being educated, you are being made aware of many things that you were not aware of. At the same time, you still have the opportunity to ask questions like you would do in a normal press briefing. So this one, this event is richer and bigger than a press briefing. So to that extent, you will benefit more, and whatever you are going to report, you will do so from a more informed position than you would possibly had we arranged a press briefing. So ladies and gentlemen, as the PS has said, we are happy to see you all here in the big numbers that you have come. Having said that, I would like to invite WHO representative for Botswana, Dr. Josephine Nambos, to come and speak to the objectives of the RC73 meeting that the PS talked about. Dr. Nambos.
Thank you, Director of Ceremonies, Permanent Secretary, Deputy Permanent Secretary, and the Director of Public Health, senior government officials, fellow colleagues, our valued members of the media, ladies and gentlemen, ladies and gentlemen of the media, and really fellow attendees, we really want to thank you for coming this day and honoring this invite. And it is all about the WHO Regional Committee for Africa, which will be held here in Botswana already on the dates that have been highlighted. You will notice that it is the 73rd Regional Committee, and at the same time WHO is really commemorating its 75th anniversary, which means that the Regional Committee only started 2 years after the formation of the World Health Assembly, of the World Health Organization. As the session approaches, it is really crucial that we equip the media with the knowledge necessary to accurately and comprehensively report on the key issues that will be discussed. The 73rd Regional Committee for Africa, and when we say Africa, it's not the whole of Africa, but it is the Afro region, which is really sub-Saharan Africa, and we leave out some of the countries far north. It has about 47 countries, and the aim of this committee is to address various critical health challenges facing the African region. These challenges encompass a wide range of topics, from infectious diseases to issues that are impeding African countries reaching universal health coverage, health system strengthening issues, and emergency preparedness and response. The committee will convene to deliberate on strategies, policies, and partnerships that will enhance health outcomes across the continent. Usually, this meeting is organized in different sessions. Some are held in plenary, then there are special events, and then there are also side events on key topics that the region or the ministers of health have agreed to. Today, I'm here to provide you with the overview of the key topics that will be covered during the upcoming session. The most important is really trying to get all African countries to reflect on building resilient and robust health systems, which is vital, and really it is what we are looking at in the address of both the current and future challenges, health challenges. As you are all aware, COVID-19 highlighted existing systems, existing weaknesses within all our systems, not just for Africa, but globally. Deliberations will focus on strengthening and making sure that we stamp out the weaknesses that we discovered, and then enhance healthcare workforce capacity and improve access to quality of essential health services. Key topics to be covered under this agenda item in Africa include the regional strategy for 2023-2032 on diagnostics and laboratory services and systems for the WHO African region. This strategy recognizes the gaps that we have in diagnosing all our patients, and it aims to provide equitable access to accurate, reliable, diagnostic testing in the region, which has often resulted in frequent misdiagnosis of diseases and conditions. Strengthening this aspect and expanding them to all levels of the health system will enhance availability and accessibility to the population as required for the successful implementation of primary health care to achieve universal health coverage. Africa is a continent with diverse cultures and landscapes. It's a home to a vast array of health challenges. Where significant strides have been made in improving healthcare access and outcomes, many people in the region still lack adequate access to health services. Hence, a discussion on universal health coverage, which is core to the pillar of sustainable development goals. And it strives to ensure that all individuals and communities can access quality health services within their reach without experiencing financial hardship. This is at the core of everything that is going to be discussed in this meeting. Another topic that will be covered during this is the antimicrobial resistance. What do I mean by that? More and more, the molecules that we use for treatment of various diseases have now caused the microorganisms we are targeting to get resistance to these molecules. So we are really trying to protect as much as possible the molecules that are already in existence. Oftentimes, it takes about 10 to 20 years roughly to come up with a new molecule. So that's why we try to come up with interventions to protect the ones that we are already being used, because it won't be easy to move into other molecules. So this becomes topical, and this is really a significant health threat, and Africa is no exception. Through the regional strategy for expediting and implementing monitoring of national action plans on antimicrobial resistance in the WHO African region, the member states will address the rising concern of this issue of resistance and the urgent need for coordinated efforts to combat it. The potential of digital health technologies in transforming healthcare delivery will also be discussed. And I think this is the new area of our focus. It includes issues like telemedicine, because you now perhaps in some of the African countries, sometimes you don't even have to have a consultant, for example, surgeon, to do all your operations. But using the technology, you can have the consultant surgeon helping so many young surgeons in the remote areas do those operations. This is where we are moving to, and it is working in most of rural Africa and in other countries. So this will include ways to harness innovation to improve health outcomes and strengthen health information systems. This would also reduce on the referrals, because people have to travel so many miles to come to a place where they can get a service. Sometimes when we are costing health care, we don't take into account the transport costs the patient bears. We only look at the treatment. But there is a lot on that arena as well that needs to be looked at in all countries. In 2020, the 70th session of the Regional Committee for Africa adopted the strategy for scaling up health innovations in the region. During the RC73, a progress report on the implementation of this strategy for scaling up health innovations in Africa will be presented to member states. Through these discussions, member states will further discuss their digital health technologies. And I'm sure here in Botswana, we are really moving towards that as well, and with the help of the Ministry of Health. Malaria also remains a problem, although not so much in this country, but elsewhere in Africa, it's a major public health concern for most of the ministers. At the 73rd session, discussions will focus on finding sustainable financing solutions to strengthen the malaria response in the region. Financial resources play a crucial role in malaria control, prevention, and elimination efforts. For Botswana, the focus will be more on the elimination aspect of malaria. These topics I've talked about are just a small part of the topics that will be covered during the RC73. Many more topics, such as strengthening community protection and resilience, multi-sectoral actions to address the nutrition and food insecurity crisis, addressing the challenge of women's health in Africa, especially the increasing rates of cervical cancer, and accelerating progress on neglected tropical diseases, diseases like river blindness, diseases like schistosomiasis. What is its name? The common name, not the schistosomiasis. Bilharzia. Those small diseases will also be discussed. Also, there will be a great focus on health security, trying to make sure that the African region is protected from any upcoming, maybe pandemics, epidemics, and so on. So long-term solutions within the context of our region are also going to be discussed. The commemoration also of the WHO 75th anniversary will take a small part of this meeting, which would be basically a reflection of where we've come from as an organization and where we are now, and basically where we want to go. So it would be quite interesting to walk through that journey with all of you. In conclusion, this 73rd session of the WHO Regional Committee for Africa presents a vital opportunity to address pressing health issues and work collectively towards building a healthier, more resilient Africa. As members of the media, your role in reporting on this cannot be overstated. By disseminating reliable information, you contribute to raising awareness, fostering informed public discourse, and ultimately shaping positive health outcomes for the region. We really look forward to your active participation in the upcoming session and hope that your reporting will help catalyze positive change in the African healthcare landscape. One thing I may need to mention at this time is that you as members of the media will also be expected to register for your participation, and more details about that will be communicated through the different people. I want to thank you so much for your attention, and let us together make a difference. Thank you.
Ladies and gentlemen, Dr. Nambos, can we make an appropriate round of applause for Dr. Nambos? Yes, that was Dr. Nambos, WHO representative to Botswana, sharing more information about the RC73 event. And she rightly said one of the aims of this session is to afford you an opportunity to learn more about the event so that you can accurately, to use her words, to accurately and comprehensively report on the RC73 event. And she also shared with us that 47 ministers of health in sub-Saharan Africa will be in Botswana. Did you hear that? 47 ministers of health will be in Botswana during that week. And it's a very, very big thing. It's a first for us as a country, and that what will be discussed are issues of health challenges that African countries are facing, especially the sub-Saharan Africa region, issues of communicable and non-communicable diseases, issues of how to respond or how to best respond to health emergencies. Those are the issues, amongst others, among the many that will be discussed, including digitalization of health services, so that issues like telemedicine, could be adopted by many African countries to improve health outcomes for our people. That was Dr. Nambos. Thank you very much, Dr. Nambos. So what we are going to do, ladies and gentlemen, the Ministry of Health together with WHO, they are very caring organizations. We know that many of you that just woke up and came here, so you could not have tea. So we will have a 10 minutes tea break. And during this 10 minutes tea break, PS Ms. Grace Muzila, she has another event that she will be attending. So fortunately for her, she has a deputy. I introduced Reketi. I also introduced, Reketi also has a deputy, regularly. So they will be here, all questions relating to the Ministry of Health, they'll be ready to answer. So if Mamuzila doesn't come back, know that she's well represented. So ladies and gentlemen, we'll continue with our program when we come from the 10 minutes break. It's exactly 20 past 10. At 10:35, let us all be back. Ladies and gentlemen, thank you very much. Please outside.